So actually, you guys can turn on your mic and just tell me like what semesters you guys in. Let's make it more interactive and more exciting session to share with you guys. So before that, let me introduce myself. I am Piong. Just call me Piong. You don't have to be the fancy Dr. Piong or whatsoever. Just call me Piong will do. I was also just like you guys. I'm from IMU and uh, just graduated 2019 actually. So I've actually been in Hong Kong for only less than 8 months. So I'm really excited to share my experiences with you guys. Okay, can you guys see the slides here? You can, right?
Yes, we can see.
I want to make it full screen and I do not know how. Wow. Okay, so what is so exciting about Hong Kong anyways, okay? Hong Kong is a very beautiful city and I tell you, I love it every single time I am here. I've been loving it since the day I came. I left Malaysia in around January, and here I am here on my 8th month in Hong Kong. It's really a different feeling. I'm so lucky. I managed to escape this COVID thing from Malaysia. Everything is so terrible now in Malaysia. How many cases a day now? 20,000?
20 over 1,000.
20 over 1,000. Wow, that's a lot. And do you know in Hong Kong the cases are only less than 5 a day, and we are constantly packed with so many people. Like MTR is always packed, the shopping malls are always packed, and yet Hong Kong has managed to control this situation very well. Like 5 a day is incredible though. 5 a day. Okay. So what makes it so convenient in Hong Kong? Why is working in Hong Kong very good? Transportation, as you guys can see. Transportation, it's only like few minutes away. Okay, I live in Tsim Sha Tsui, which is an hour's ride, an hour's walk. If I were to walk, it's an hour. But if I were to take train, it's about 5 minutes to my workplace. And then you know lah, Hong Kong is like a financial hub where there's a lot of rich people, there's a lot of businesses. Hong Kong is a very strategic place to do businesses, to hold many businesses, different businesses. Okay, and then yes, we have very nice food and shopping centers as well. So very interesting places. Let me move on. So for many people of you guys here, I think not many people here knows how to speak Cantonese, right? Let me tell you, I don't know how to speak Cantonese as well. And my Chinese isn't very good also. 可以一点点说，可以说简单的华语，就是这样。广东话都羞羞的 OK 的，OK 嘅，你唔使你都可以聽到我廣東話都係好差嘅。It's very shit. I'm so sorry, mind my language. Okay, all right. We also have many nice buildings. Where I am working at, that's very nice skyscraper. I will show you the view in a very short while. But let me describe a little bit about my company. Okay. Before that, I want you guys to screenshot this page. I'll give you guys an assignment. Every one of you guys will have to text me at the end of the session. Okay. Send me a message regarding what is your ideal type of chiropractic practice. And then winner, I will send them 300 ringgit. Okay. I will pick the best answer and then I will send them 300 ringgit. So guys, screenshot this page before we move on. What is your ideal type of chiropractic practice? It could be what kind of chiropractic setting you want it to be. Do you want it to be big? Do you want it to be like corporate-like? Or do you want it to be small, quiet size? Or do you want it to have a lot of modalities, a lot of machines, different kind of techniques, different type of skills? Yeah, send me about less than 100 words about what is your ideal type of chiropractic practice. Any answers, long or short, no problem. But I will pick anyone and I'll send them 300 ringgit. I'll PM you after that. So text me at the end of the session, all right? About my company, it is founded in what this company is called is New York Medical Group. Okay, we were founded in 2016. So far in Hong Kong is the biggest chiropractic center. Also, we're aiming to be the biggest chiropractic center in the world. Do you guys remember like IMU when we do the internship program? Our clinic is considered very big, right? IMU Bukit Jalil or Setia Walk, IMU, the internship clinics are actually very big. Some of you guys haven't seen it, some of you guys already seen it. Yeah, this clinic that I'm in here is probably 4 times bigger than Bukit Jalil Clinic. Okay, this center itself, so there's a lot of chiropractics, a lot of chiropractors currently in this room right now. We have about 22 branches spread across Hong Kong, and we've hired about 30 chiropractors. 30 chiropractors is actually a lot of chiropractors in a company. Okay, so what makes us so special is that for every patient that comes here, we ensure the best treatment for them, and we use very advanced technology for patient care. Okay, so just so you guys know, we also have a partnership with IMU. That's why we're hosting this talk, because we're having this partnership to recruit more people over to our company, and we're currently looking for more people. So as you can hear this talk, we want to, you can approach me at the end of the session, ask me more about how this works here. Okay. Also, another thing very unique is that we have an ecosystem. Okay, we not only have chiropractors, we are multidisciplinary. So we have chiropractors, we have orthopedic, we have dentists, we have radiologists, we have a lot of people. We even have physiotherapists. So we work alongside each other. Whereas in Malaysia, sometimes it's chiropractors will work with chiropractors, orthos will work with orthos. Sometimes chiro will say ortho is not good, or ortho will say chiros are not good. But in MYMG, we work together. Okay, when we feel that the patient cannot handle this, we will refer it to the physio to help work with some muscle works, or sometimes this is not within our practice, then we send to the orthopedic. We're all in the same building. Okay, we even have dentists, we even have facial centers, beauty centers, a lot. So we just do it with multidisciplinary lah. So it's very exciting to work here, because you get to decide so many choices, you get to make so many good decisions to ensure the best care for your patients lah. Okay, so our core values, 4 core values: one-stop pain and wellness. Basically, patients has one goal, just to get better, and the doctors here have one goal, just to get better. And every patient that comes here, we serve them with the best service ever. Okay, patient will not think that, you come here, you feel like, just like that, you just adjust me and go. It's not just that. We have so many machines, we have so many nurses. Nurses will help doctors, and doctors will help nurses. And sometimes we have front desk to assist the patients, we have nurses to assist the patients. Yes, this whole cycle makes the patient feel that it's worth coming in here. Okay, also it's very safe, and we ensure very good quality, and this is a very ethical clinic. Working here, we are very professional and very ethical. We do everything step by step. All the doctors here are very disciplined. Okay, so let me show you some of the machines, some technologies that we have here. Okay, this one here, it's our MID machine. As you guys can see, it's a decompression therapy. What you see in IMU, what you see elsewhere is nothing like this. This is made in Korea, and it has helped a lot of people, and it's proven to be very, very effective with patients with disc herniation on the cervical joints or the lumbar joints. Okay, so we're able to help them. Also, as you can see, this part here, this is one of the very good machine that helps us with dealing with inflammation, muscle fatigue, muscle tightness. It's like EMS, but it doesn't need to go through. It can go through It can go through shirts. Okay, let's go to the next slide. This one is our iTrack machine. iTrack, what it does is it deals with cervical lordosis. Patients with decreased or reduced cervical lordosis, we put them into this machine. Yep, we have beautiful views as well. We're located at the 41th floor in Langham Place, Mong Kok, or Wang Kok, Wang Jiao. Okay, you can see the view is beautiful, it's brilliant. Okay, sometimes working here, I don't even feel stressful at all. I just need to look outside the window like that. It just makes me feel so good, you know? Moving on, you see the clinic size is huge. You can fit a Star Wars spaceship into here. And this is our chiropractic table, as you can see too. We have a lounge for our patients or whoever. If I want to do meeting or conduct an interview, I can just come up here to the 50th floor. So 41st floor is the chiropractic center. The 50th floor in Langham Place is in Mong Kok, is the lounge. So basically, you can bring your clients here. You can bring you can conduct any meetings over here. You just feel very peaceful. You feel very thankful to have a place like that. Okay. Let me show you some of our doctors. So as I told you, we have 30 over doctors in the clinic. So here, these are our group of doctors. Some has been here for about 15 years. Some has been here for 10 years. Me, myself, I've only been about 7 months. And I'm already telling you, I'm loving it here. Okay. This one is our boss. He is Dr. Eric Chu. Well, he founded this clinic, and initially he was from Taiwan, so he does not know Cantonese as well. He studied in America and came all the way to Hong Kong because he thinks that Hong Kong is a good opportunity to work. He started with one clinic. Now he himself has 20 over clinics. Okay. I think he's only chiropractor that is a billionaire and he's still working as a chiropractor. Okay. So let me tell you a little bit more. Okay. So in the clinic, we have various clinics. This is another bunch. There's one doctor that loves Star Wars. That's why you can see a lot of there's the battleship, and now there's the Star what do you call that? The Star Wars helmet. So I took one and wore it the other day and took pictures of it. Okay. Yeah, it's very free and easy clinic. Another question which I want you guys to text me later or comment below. I think texting me is better so I get a clear idea. How much do a fresh graduate earn in Malaysia? I want you guys to comment below or either just PM me later. Okay? Yeah, write it down here so we can share. It's good too. Sorry. Don't worry, I think texting me will be better. Some people might not know. Some people might need more time to think about it. Yeah, so how much do you earn? I remember last time when I was in Malaysia, I was earning okay, but until I came Hong Kong, I feel there's a much more opportunity for you to earn and learn to be a very good chiropractor. Okay, let's move on. Why believe in us? Okay, first off, we offer very good incentives. Okay, 5-figure salary in RM. It could go up to 6-figure salary in RM too, depending how long you work here. Okay, 5-figure salary every month. Basic. So no problem. Just text me and I will brief you through more about it. Again, we are one of the biggest chiropractic centers in the world. Use many different skills, different techniques. Okay. We also make sure that our treatments are all the latest research-based treatments. Not only that, we have successfully treated a lot of scoliosis patients. So we have a very secret trick of how to deal with scoliosis. And most of our patients will show some sort of improvements back towards the midline after a few months of treatment. Also, one thing very interesting is when you're training, when you come over here, we provide a lot of mentorship. So I know COVID has been hard for you guys to have like practical classes. It's very hard for you guys to practice your skills, to improve your skills, but you don't have to worry about it because we provide the guidance you need. If you think that you're not confident in yourself, you think that you cannot speak that well as well, you also don't worry, don't have to worry. Because initially, I came here not knowing Cantonese. I don't know Chinese that well also. So with a lot of learning, with a lot of mentoring, I was able to improve my skills. My adjustment skills improved and my speech improved. Like I'm able to communicate to people with people more confidently without, I don't need to be scared. Okay. Especially my skills. I was really not confident with my adjustment skills one. I always think that, what if I injure the patient? What if I hurt the patient? That's why when you come over here, we provide all the mentorship that you need. Okay. So what's on top of that is when you are doing mentorship, you still get a 5-figure salary. You still get a 5-figure salary, which training would last about, which is really good. Usually we call this internship, but we just want to say that we're starting mentorship here, we're starting training, we are already paying you 5-figure salary, basic. Okay. So far, do you guys have any questions? And okay, who are we looking for? We're looking for fresh graduates. Okay, we're looking for people that are open-minded. Okay, we're also looking for disciplined players, disciplined doctors, those that are willing to listen, those that are willing to accept changes. Because in MYMG here, New York Medical Group, we are constantly changing. We are constantly upgrading ourselves. Okay, we don't stick to one thing. If it works, correct, we will stick. But we are constantly expanding, constantly bringing new machines, we're constantly bringing new ideas in the clinic for everyone to use, to learn. Okay. All right. Let's see. Any questions so far? You guys can drop me a questions. I will try to answer it. Then after that, let me show you around Hong Kong, like what I think of Hong Kong so far and what my journey has been like in Hong Kong. So far, there is no dietitians working at MYMG, but we have TCM working at MYMG as well. Yeah, so far we haven't had the thought of hiring dietitians, but that's a good idea though. I can bring it up. Okay. Any other more questions? Feel free, just ask me anything. Anything? Well, how is working at MYG different from working in Malaysia as a chiropractor? I'd say, Hong Kong is like a very efficient country. Okay, Hong Kong is generally a very, very efficient, fast-paced country. So everything we do, it trains us to be very disciplined, very efficient, very fast. So previously back in Malaysia, I was a little bit slack, but I would say I don't know the ways to be a good doctor. Now, coming over here, I learned so many things. There's so many leaders here. There's so many colleagues and peers here that are willing to teach. There's no hierarchy. There's no drama, and everyone's the same level. Although they earn 6 figures, they earn 7 figures a month, we're still the same level. They're all willing to share. Okay, how is it working differently? It's actually pretty much the same. It's just that we are more fast-paced and we deal with very, very advanced technologies here. So if you ask me, chiropractic, yeah, of course we do adjustments, we do decompression, we do ultrasound, we use modalities, we use a lot of things, anything that can help a patient. We won't stick to one concept. We use many, many different ideas, different approaches in terms of helping our patients. Okay. Other than Chiro, do MIG accept graduates from other programs? Such as what program? So far, we have orthos, we have traditional Chinese medicine, we got physios, we have a dentist, but so far we are hiring mainly chiropractors. N&D, not really. Nutrition, not really, but I can bring it up too. It could be a good idea in the future. TCM, yes, for sure. Okay. Any other questions? Okay, let's move on then. Let me tell you story of my life. All of these pictures are taken with my phone, so I film them as we go. I capture the moment as we go. I came here on the 21st of January, and then yes, this is the picture taken on my flight and 21st of January 2021. Oh, sorry, I see a question. Can IMU students intern at MYMG? I would want that, but that has to be more things to be done with IMU. We need a collaboration. We need permission from IMU to be able to allow us to work together with internship. That's a good idea. I will keep that in mind. I will find someone to talk to about this, and hopefully you guys can come over with an internship. We would willingly say yes, without a doubt. We would say yes, even if you guys want to come over to just shadow us for even a week or two. By all means, come over. Okay. How's the demand for chiropractors like in Malaysia and in Hong Kong? I would say in MYG, the demand is extremely high. Even we have 30 doctors, but all of the 30 doctors are extremely packed. I've only been started working 3 months. Officially started 3 months. I've been training for the past few months, and I started working 3 months, and I'm seeing about 40 patients now a day. 40 patients now, it might seem a lot, but it's really quick. It's really quickly done, and patient feels very satisfied. And we're constantly hiring chiropractors. So don't worry. If you want to join us, just text me later. We can talk more about it. Okay. I just want to share you my experience. We're seeing about 30, 40 patients a day. Some doctors just see about 90 patients a day. And how can we do it so fast? It's very simple. We have many people helping us. It's not a solo practice. It's a teamwork practice. We have like nurses that would help us. We have other doctors. We have physios that help us. So all we have to do is adjustments. Sometimes we do some soft tissues, some ultrasound therapy, and the rest we will work together with the nurses. Nurses are our best friend. So they're always helping us whenever we need. That's why we're able to see so many patients. That's why it's so efficient. Okay. Oh yeah, by the way, we use a very nice TV here. This TV here, this screen here is for explaining x-rays. Okay. We can put on our x-rays and then we can start explaining. Let me show you a little bit of how it works. So we see x-rays on the screen and we start explaining to patients like that. So they get a very clear understanding of how their x-rays are like. So we do x-rays all the time for our patients. So we know how to tell them, we know how to treat them. We're very specific. We make sure that we find the right joint to adjust them, or we will find the right problem, right best treatment plan for them. So looking at this x-rays, it really feels like, oh, we're doing it very professionally. Okay, we don't use films. We use all virtual films. Okay, let's move on to my life. Okay, let's go back to the screen here. All right, on the 21st of January, I finally left Hong Kong. it was hard decision. It was really, really, really tough decision. I didn't want to go. Initially, I just wanted to stay in Malaysia because I wanted to stay in my comfort zone. And Hong Kong is just not for me because I can't speak Cantonese, I can't speak Chinese. That is the biggest flaw why I didn't want to come to Hong Kong. Okay. And I thought that in Malaysia I could earn a lot of money as well. But then COVID, and then COVID again, I just got frustrated and then decided to leave. So I took a leap of faith and come here without knowing anything, without knowing how Hong Kong is like, without knowing Hong Kong is very big. Okay? It's actually very big. Okay? So this is my quarantine. I actually undergo 21 days of quarantine, which was hectic or is depressing to stay in a room for 21 days, especially in Hong Kong room. Because the Hong Kong room is about like what, 150 square feet? That's like two of your Chiro intern rooms in Hong Kong, in Malaysia. Okay? It's extremely small. I had to stay here for 21 days. And then on the last day, on the 10th of February 2021, and it was very cold, I could smell like the air. I was so excited to leave Hong Kong, leave my quarantine room. On the 10th of February, I finally left. And yes, it could be the most exciting day of my life because I don't know how Hong Kong is like. I didn't even see pictures. I didn't even look at reviews on places to go. I just closed my eye and came because I trusted the company. Okay. So when I came out to Hong Kong, this is the view of where I'm staying at right now. Okay. I live in this place in Tsim Sha Tsui, and I live by the harbor. Amazing view, amazing place, good food, good shopping centers, and I'm happy that I'm staying here. Okay, so this is also outside of my where I stay. Okay, so I can see the island. It's really, really beautiful. This is the whole of. How far is it from your home to clinic? 5 minutes. 5 minutes from with the MTR, but an hour's walk with train. Oh, if an hour's walk if it's from my place. Okay, 5 minutes by MTR. So efficient, very efficient. Train is efficient in Hong Kong. It's so fast, so efficient. I never took a public transport in Malaysia because I think that it's terrible. But when I come to Hong Kong, I thought it was terrible too. Because I thought Malaysia is terrible. It should be same thing in Hong Kong, but it's not. Everywhere is so convenient with MTR. How much is the MTR fare in RM? About 8 ringgit? Sorry, about 2 ringgit to 3 ringgit. Yeah, very cheap. There's a government subsidy, and so transportations are very cheap in Hong Kong. You spend about less than 1,000 transportation. Okay. What are the average monthly expenses in Hong Kong? For me, myself, I'm a big spender. I like to enjoy my food. I like to enjoy my time. I like to shop. Okay. So I like to stay in a cozy room. So where I stay is my room is very, fairly big, very comfortable. And expenses wise, I've calculated about 20,000 Hong Kong dollars. 20,000 Hong Kong dollars a month. That is, hold on, let me just tell you my expenses. It's 20,000 a month. My room, Hong Kong dollars, okay, let's convert in ringgit then. My room itself is about 5,000 ringgit, 5,000 to 5,500 ringgit Hong Kong dollars per month. What I eat, what I shop, that takes about my transportation, that's about additional 5,000 ringgit. So you could imagine the salary, how much it would be. So now I'm already spending about 10,000 on my living expenses. I tell you, I still have about probably 70% to save. Yeah, I still have 70% to save. I only took out about 30% for my living expenses. Okay. What is the average room rent? So it could differ from 3,000 ringgit to about 7,000 ringgit for single person stay. Okay, it really differs on where you stay, what are you staying at, how big is the size. But I can tell you the cheapest one, some of our colleagues are staying about like 3,000 to 4,000. Like some of you guys might know Dr. Aiman, he's a good friend of mine. He is also working at MYG. We have a few colleagues here are also from Malaysia. So you don't have to be afraid that you're feeling left out. So room rents are about 4,000 to 5,000 ringgit on average. Okay. So these are the view from my clinic. See, these are some of my Hong Kong friends. This is Sherry. We went to Cheongzao. That's a very nice island when we arrived. That's very nice view to take pictures. And this one over here is Dr. Aiman. Some of you guys already know him. Okay, he's your senior, and he's also my classmate. Okay, Cheongzao is a really beautiful place. I'm just documenting down my memories. In here, they serve like very good food here. You have to take about an hour's boat ride to this beautiful island, and you get to see beautiful sunsets. And they do fishing sometimes, and you can see here, the fishes are just like lying there. It's just fresh off the sea. Really, really exciting. And you get to cycle around the island. Okay. Another of my friends. Okay, so very nice place to take pictures. This is also outside from where I stay. I can just take ferry to the island. It's very convenient also. And on your right here is one of the clinics in Central. You get to see this beautiful view out from the clinic. Okay, so as you work, you can see beautiful views like that. It's just very relaxing. I'm a coffee lover, so if you guys ever come here, you can hit me up. We can go for coffee. I can treat you, okay? Take you for good food, bring you very, very nice places. And Hong Kong has very nice places for coffee. And they're all very, I would say, hipster. Okay? Yep, Hong Kong is a coffee haven. Also, again, Dr. Aiman appears in feed again because I always hang out with him. Okay? Can you guys actually see the pictures? Can, right? I'm not sure if you guys can see. Okay, thank you. Thank you for the reply. Also, when you come here, we have a very good seafood here. The seafood is our senior chiropractor. He is very skillful in adjustments. He has very good knowledge about chiropractic itself. He has treated a lot of scoliosis patients, and he mostly sees a lot of kids, like 7 to 15 years old, and a lot of people come just to see him because he's proven a lot of scoliosis treatment to work. And yeah, when you guys come over, he treat you for steak, he treat you for wagyu beef. He's always like that. Very, very nice person. Okay, he can't speak Cantonese as well, only English and Chinese. His Cantonese is poor. So as you can go for hike that time, you can go during sunset or sunrise. You can see very beautiful skyscrapers. And you can see this is where I stay, somewhere here. You can see this is where I stay. Okay, you can see the whole Hong Kong in this peak. My boss asked me, how does it feel to work with a view like that? Then I mentioned, no, we're not working. I'm enjoying. I'm enjoying my time here every time working in MOMG. So this is also the view taken from this clinic itself, which I'm going to show you in a little bit. All right. I am done, and it's time for me to show you around the clinic. Don't forget, remember to PM me. What is your ideal type of chiropractic practice? I want every one of you guys to send me this. Okay? Even those dietitian students, you guys can send me those. What is your ideal type of dietitian practice. I will also keep that in mind. In future, we may need to hire you guys too. Who knows? Okay. So what is your ideal type of chiropractic practice? Send me what kind of modalities you guys like to use, what kind of machines, what kind of skill set you want to use, and I will choose a winner, and they will get 300 ringgit. Next is how much does a fresh graduate earn in Malaysia? Anyone, even dietitians can send TCMs of physios. Okay. All right. Let's take a tour around the clinic. I will stop sharing the screen. Any questions so far? Any questions so far before I give you guys a tour? Okay. Oh, downsides of working. Of course, last one before we go. Downsides of working in Hong Kong. Well, sometimes, because when you come over here, you don't have really a lot of friends initially because you don't know a lot of people. So all you have is a group of doctors that are your friends. Okay? So sometimes you feel lonely, lor. Sometimes you feel like it's not that nice. It's being here alone. It's quite lonely at times. Don't hold on. Let me just off this. And also we have a little bit long working hours. We work from 10 to 8. It's pretty long, but as you're working, time passes very fast. I just gotta be honest with you. I can't say everything here in Hong Kong is very nice. But I can tell you long working hours. And then Cantonese law, if you don't know Cantonese. English law. I mean Chinese law. Yeah, you can ask me later. I'll still call you. I will explain everything in details. Okay, let's look around the clinic. So as I promised you, this is the view that we're looking at. Okay, you guys can comment if you guys stop me anytime, or you guys can turn on your mic already. Okay. So this is a very beautiful view. Give me a second. Let me just change it around. 41 floor. You can see the sea. You can see this is the hotel opposite us. And we're one of the tallest buildings in Mongkok. You'll be wondering, how can a chiropractic center be so successful? In Hong Kong, everything is possible. Okay, so I'm going to show you around the clinic. Okay. These are nurses. Okay. Hi. So these are all the other chiropractic rooms. We have many different rooms here. I think we have Botsy. We also explain X-rays with the screen. This is the machine that I showed you earlier. Decompression Therapy. It helps with treating disc herniation problems. More to come. You guys can ask me anything after that too. Okay, just send me a text. Here is where we talk to our job as chiropractors, and that's enough already. Oh, hi, meet Steve. This is our doctor. He's also been working here for quite some time already. Say hi, Steve. Okay, all right. Our nurses and sports therapists. He is 190 cm. Hi, okay, so very huge clinic and very beautiful clinic. We also have very advanced another new machines that we just have. This is called the All-Core 360. It's from America. So what this does is it helps patients with scoliosis or disc herniations as well. It helps stabilizes their core muscles and their lower back muscles as well. So they don't have to specifically do abs exercise. We don't have to teach them exercise. All they have to do is be on this machine, and they can start strengthening their core muscles. This is another of our very advanced spine MT. It's also helping patients deal with disc herniations, and also helps patients with their numbness, their neck pain, and this is the station that we set up for them. Okay, we will key in numbers, we'll key in how heavy the patient is, how do you want it to turn, how do you want it to twist, because usually decompression therapy is only one directional, which is superior and inferior thumb, just pulling. Okay, here we get to rotate, we get to lateral flex, we get to flex them, extend them, all we get to deal with all on this machine. Okay, let's move on to more places. Okay, this is our lobby. Okay, this is our lobby. So patients will wait here and wait for their turn. It's pretty big. And our assistant manager, can you say hi? Hello. Okay, that's why we deal with patient bookings and everything. Very interesting. Sandy, say hi. Hello, Dr. Ada. Hello. So this is the eye track center. The patient's probably still doing eye track, so I wouldn't knock. Another view here on the other side. Basically, it's a 360 view. Our whole center goes in a circle. As you can see, now it's forming the circle. So yeah, this is one of our machines. Ultrasound, EMS, IFC, pre-mode, whatever mode you want that is in this machine. Okay, so we do ultrasound, we do modalities as well. And then we also have, sometimes when the patient is hard to adjust, we will use massage machine. So basically it helps with relaxing the patient's muscles. Okay, let's move on. I just wanted to show you guys a lot of, it's all the view and the vibe in the clinic. It's interesting. It's really interesting. Let me see if my boss is here. Maybe he can help. Okay, here's the old wing. So you can see everything is slightly older, but not exactly very old. Okay, here another chiro room. Patients doing decompression therapy. Okay. Okay, so another decompression therapy. We have many of these here because we have a lot of patients. This is the ST machines. I think you probably saw it just in one of the pictures. Helps you relax the muscles, helps you strengthen the muscles. Okay, reduces inflammation. It doesn't have to go through shirt. You can put your hands here and you feel your whole hands twitching. Let's move on to the next room.有冇睇到 Dr. Kevin? 嚇，佢啱返食飯啦。OK，好好。OK，你哋可以 say hi。OK，我哋嘅姑娘。No, it's Zoom meeting嚟嘅。OK。Okay, let me just go back to my room. We're only halfway done. The clinic is too big. This is the TCM center. And this is our Leander table. We use this to treat a lot of scoliosis patients. Okay. And yes, the eye track machine, I finally can show you guys. Also, this is the eye track machine where patients will just sit down on here and this thing will start pulling and creating the natural center. This is our pediatric center. So we also have pediatric here. Hello, Chris, say hi. This is our physio. Okay. And again, very beautiful view here. Let me just show you guys. This is the whole sea view that we have in our clinic. Hope it's very clear for you guys so you guys can see better. Okay. I think that kind of concludes.
Dr. Piong, are you there?
Yes, I am.
Okay. Okay. Dr. Piong, are you still there? I think I can't hear him anymore.
I think we lost signal.
Yeah, I think. Oh, he's there. He's there.
We're back.
All right.
How long has it been blocked? Hello?
Just over a minute. It's okay. You may continue. We have a few minutes more.
Yep, I'm actually done. So,
Done?
what do you think of the clinic?
Nice. I
Very
really
nice,
like
right?
the clinic. Yes.
Yes. I hope you guys can come over here for internship though. If we can work
Yeah.
together with that IMU and MYMG, we can work together so we can bring students here over
Yes.
for internship. Because we don't mind having all of you guys here to help us to learn from us. We are very happy to let you guys learn from us. Okay?
Okay.
Yep.
Thank you so much, Dr. Piong, for
Yeah, no problem.
the session.
No problem.
We really appreciate it. So to all IMU students who are in this session today, should you would like to know more on the ways and steps to, to send in your CV to New York Medical Group, please email it to me, or you can even Teams your question on your CV to me. Then I will be the liaison officer, and I will make the application on behalf of you guys, IMU students, to New York Medical Group. Other than that, I think we are at the end of the session. Do you think it's okay for all of us to take a photo together? So if you guys may, please on your camera for just a little bit. We'll take a quick photo, and then that's it for today.
Okay. That's
Yes. All right.
so
Okay. Alicia.
everyone.
Okay. Boh Xuan Yang, can you just put your camera for can you just on your camera for a while? Ooh. Alicia, are you there? Okay. Hi.
Hello. Hi. Wow.
Wow. Okay. All right. So I'm gonna take a photo now. So get ready. 1, 2, 3. All right.